My name is Dr. John Kelly, and I've been practicing family medicine in the Asheville, North Carolina area for about 30 years with a strong emphasis on prevention, along with my office manager wife, who's a registered dietitian. We are for a single payer program to help take a lot of the abuses we have right now from doctors' time and energy being directed away from direct patient care and more towards trying to deal with prior authorizations for meds that you know your patient should have, for dealing with third-party payers who throw lots of paperwork that prevent you from giving the care to your patients that you need, and unfortunately having to deal with people who look at the services that you've provided and try to second guess you and say, oh, you're spending too much time with this patient, and very few outcomes measures are being taken right now to really look at your success in keeping patients out of the hospital, keeping them healthy, and dealing with the preventive aspects of care and the mental health aspects of care, both which take extra time but are very rewarding in terms of the outcomes you get for patients that typically do demand a lot of healthcare services for optimal outcomes. So we support single payer, we support giving doctors the ability to spend more of their time taking care of patients, and we have seen it make a wonderful world of difference in our patients, keeping them out of the hospital, keeping them healthy. When we do that, we're just finding it's harder and harder to do that. So unfortunately, doctors right now are finding that recovery audit contractors are not following Medicare rules, and it leaves a bad taste in some of them for the idea of single payer if they saw this type of abuse be perpetuated. And fortunately, that even includes our former past president of the North Carolina Academy of Family Practice having had to deal with a company called Advanced Med. So we look forward to emphasizing the positive things that doctors can do with their patients when they get the third-party payers who obstruct health care out of the way.